this is Brian Shinak. We're going to be going through and giving sort of primer on how to enroll a patient in the Vicryl Rapid Absorbable Suture Study. This study is a randomized controlled trial that is comparing Vicryl Rapid, which is an absorbable suture, versus standard non-absorbable suture repair in simple traumatic extremity and trunk lacerations in adult patients. And this is the purpose of this is that in the past, typically we did non-absorbable sutures, and for most sort of laceration closures, in the past several years, there's been a couple of different types of sutures that have been developed that are made to sort of dissolve by themselves, thereby making it so that the patient does not have to return to have the sutures removed, giving an advantage to these in terms of patients not having to make that extra trip. These have not been studied against each other in terms of cosmesis and the potential to cause infection and dehiscence in extremity and trunk lacerations. This has been studied in facial lacerations before, but not in ones that are sort of non-facial lacerations. So that's what we're studying with this. To help identify a patient for this study, the first thing to do is always be looking on the track board for anything that says laceration of anything other than face, and looking for, again, for adult patients, not pediatric. So to help identify them, first of all, you'll be looking at this inclusion-exclusion criteria sheet here. Again, looking at the inclusion criteria, this is a patient who is felt to need suture closure by the ED provider. It's an adult. A single laceration, if there's multiple on different sides on different parts of the bodies, then it makes it difficult for us to track that. So we don't want to be having to figure that out. And if the wound is to be closed with just simple interrupted sutures. Everything I show you here, you'll be talking through with the provider so that they can assess that all these conditions are met. The exclusion criteria are, first of all, those that are wounds that are considered to have high infection potential. All these here, puncture wounds, highly contaminated wounds, wounds with devitalized edges, bite wounds, if they're more than 24 hours old. If they already know they have a very low likelihood of good cosmesis. Stellate wound means it looks kind of star-shaped, the wound. If it's a crush wound, if there's a large soft tissue deficit where they can't bring the wound edges together with this, if they feel like they can't bring it together. If there's no underlying tendon or cartilage involvement, we want to limit it to wounds that are less than 10 centimeters in length. There is in your packet materials, there's a paper tape there on the edge that you can use to measure, that you can have the provider measure the wound and see if it is, in case it looks like a long one, it's more than 10 centimeters. And the other thing, which we have here, should be on here then too, is it needs to be over 2 centimeters in length. If the patient is a known keloid former, if they're on chronic steroids, if they have an inability to give written consent, we only have English and Spanish speaking consents so far. If they're altermental status, if they are an incarcerated patient, all these are exclusion criteria. And again, if the patient's in a situation in which they have no telephone number and have no ability to do that 3-month follow-up, then they should be excluded. You know, an example would be a homeless patient, maybe an active psychiatric patient you can't get this information from, nursing home patient, anything in which you don't have the means to contact them for that 3-month follow-up. If there's more than one laceration, needing suture repair on the trunk or extremity. So again, this is, which we'll explain later. For the follow-up, the patients are going to get a phone call at 1 month in which we go through certain questions with them, and then 3-month follow-up in which they take a picture of the laceration and send it to us, and that's what gets evaluated to determine the final cosmetic outcome of the laceration. So again, the patient must be in a situation in which they're able to do that. If these inclusion and exclusion criteria are met, there is a paper which the provider signs that attests to the fact that the patient has met these inclusion and exclusion criteria. And go ahead and put this check the box to attest this, and that they've been okay to be randomized to this, then you'll go ahead and get that provider's signature imprinted and have them dated here. So now if you reach the point where you have sort of checked that they're a good, that they are adequate to get this study done, and they are going to ready to do it, then you want to go ahead and go through the consent process with the patient. If at any point, so at this point, if the if the patient had not met some of the inclusion or exclusion criteria, we still want to track that to see how many patients don't meet these criteria that we approach, and so make sure to check the appropriate box for the exclusion criteria. So I'm showing a different form now, but make sure and check the ones that match the exclusion criteria. Take that sheet out, put it in the completed data sheets folder in one of the appropriate rooms in the ED, so that we can track that as well. Now they have that inclusion exclusion criteria. You've had it signed off by the provider. You can then go ahead and get consent from the patient and discuss that with them. This is showing the consent sheet. The California Experimental Subject Bill of Rights, I sometimes like to leave till the end because it's a good summary of everything we do in the University of California one. Shown here then too with some of the tracked changes on it. Your form will not look read like this. We'll talk through just some of the generalities of this first as you talk through this with this patient. Again, explaining this is a study comparing Vicryl Rapide, which is an absorbable suture, versus a non-absorbable suture in the repair of simple traumatic extremity and trunk lacerations in adult patients. They're being asked to participate in this medical research study because they have a laceration that is felt to need closure with sutures. That's being done because in the past, most sutures that were done in the past had sutures that needed to be removed by providers, but there's been ones now created that break down and fall off on their own. Because of this, then we're examining these sutures. The use of these absorbable sutures for traumatic lacerations is an attractive alternative to non-absorbable sutures because it doesn't require a return visit. To date, there are no research studies examining whether it is absorbable sutures on the body, arms, and legs of adults with traumatic lacerations give the same sort of cosmesis, if they have the same infection rate, if they have the same, and if they get if they don't pop open as easily. There's going to be about 100 people taking part in the study. If you agree to be part of this research study, the doctor or provider will clean and numb your wound just as normally would. You'll be, after getting consent, to be randomized to non-absorbable versus absorbable sutures. If you're randomized to non-absorbable or absorbable, you'll be given discharge instructions according to each. 30 days after the laceration repair, you'll receive a phone call from the team asking questions that may include how the healing process is going. 3 months after laceration repair, there'll be an appointment to either take photographs by us or have the patient send in photographs to us. After that's confirmed, the patient will receive a $40 gift card to help compensate them for their time and that they're using to help get the picture for us. This is the flow chart that shows what's happening for the study. Starting here, we'll determine whether or not the patient is a candidate, go through informed consent. If they go through informed consent, they'll be randomized to absorbable versus non-absorbable sutures. Non-absorbable sutures will return for suture removal at the usual assigned time. 1 month follow-up phone call, 3 month follow-up to get the wound pictures. We keep all the information confidential. The different hospital and federal and state regulatory groups can look at the medical records. We do not share this information with anyone else. The signed consent form will be added to the medical record. You'll be in the study just during this 3-month follow-up period, and then that will be done. Responsibilities for this is, again, it's just for answering the questions during the time in the emergency department, and then during the 1-month and 3-month follow-up periods. You can say no, stop being in the study at any time and not affect, it won't affect your care. Side effects or risks, again, it's always possible to have stress or worry from being in a study. Both groups of sutures have some risk that includes infection, poor wound healing, scar formation. It is possible that one group or the other ends up having better scar appearance, and you could be in the suture group that was the one that had a worse scar appearance. There's no direct benefit for being part of the study. However, if by doing studies like this, it can help and give an idea of whether absorbable sutures are equal. If they're found to be equivalent, or non-absorbable sutures, it can help future emergency department patients who are in the same situation as the study patient. If you can say no at any time, you'll see standard care. We keep everything private and secure. We can't guarantee complete privacy. These organizations that do have the ability to look at this include these hospital and UCSF, things of the government and state regulatory boards. And mainly they have the ability to look at that to ensure that we're handling the data correctly. If there's any need to do any sort of audit of it, things like that, they can look at it to make sure that we're not misusing any data. There is no extra cost to be part of the study. There'll be normal costs associated with the emergency department visit, but there are no extra costs for being part of the study. There is payment received, again, the $40 gift card upon completion of the 3-month follow-up. We are not receiving any sort of money, so financial conflicts for this. Any injuries that occur, and treatment compensation information is listed here, including phone numbers to call about this. You're not giving up any of your normal medical rights that a patient has as an emergency department patient by being part of the study. Any questions that come up later about the study, there is phone numbers and information here. Patient will be left with a signed copy of this form. For the consent, again, this is for first signed consent. For the person obtaining consent will be you here as one of the primary investigators will sign this later. Always make sure that these pages are starting to be a little off after this one on this copy, but on the bottom of each page there will be a place for initials. Even on the pages like this in which they're leaving a full signature with date and time and their printed name, they still need to put initials at the bottom. This is an example copy where we got things a little off kilter here where it doesn't show up, but this is a page. The next page would be one. If you're using an interpreter, you need to go ahead and write down what that interpreter is, what the language is. You would get the name of the interpreter because since we will not have an in-person interpreter, you'd be using the iPads and the interpreting service that you would get the name of the interpreter, any sort of number they have, the date and time, and write that down here. This next part here is to, again, emphasize that this is all protected health information. It will be used only in accordance with the provisions of the consent form and applicable law. The study records will all be kept confidential. Would never be identified by name, social security number, address, anything like that. You'll be anything that records that are used outside of our hospital will be assigned a unique code number rather than showing the patient's actual name. Again, all these hospital and governmental and regulatory bodies would have the ability to look at our data, but that is mainly that is only in regards to looking at it in regards to this research study. And again, to make sure that we're using the data correctly, we get rid of all these paper records after 6 years. This is, on this other page here, is to show that this is voluntary participation. They understand everything we've explained to them. They do a full signature here. This needs to be a witness from someone that is not associated with the study. What I tend to do is find the nurse that's taking care of that patient, and I will, having the nurse be there for the entire thing is not realistic in an emergency department setting. What we do is what I generally do is have the nurse come over to the patient and in front of the patient say, to the nurse, "Hi, we're bringing you over here to witness. This is the study in which our patient here is going to be randomized to Vicryl Study versus non-resorbable suture. And we're going to be testing for cosmesis and rates of infection, whether the wound opens earlier than it should, and we've given all the risks and benefits and had all questions answered. And I asked the patient, do you feel like all your questions have been answered during the study? And they say yes, and then you have the nurse go ahead and sign here. It can be, again, someone else who's just not associated directly with the study can sign with that as a signature witness. And again, make sure initials on the bottom of every page. So at this point now, when you've completed consent, the patient is ready now to open within the manila folder. That's in these things. There's also another sealed, smaller manila folder that has the randomized information, where it will have the patient randomized to either non-resorbable or resorbable. If you open it up, it may look that they may still have this on it, but the main thing we're looking at here is, which this part is the one you've already completed with the inclusion-exclusion criteria. This is the part then that gives a randomization, and it asks for a collection of some additional information. So first of all, it gives information here. There's no particular cleaning and anesthesia that is directed by the study. It's whatever the practitioner chooses. The suture material is determined here. We want to record this following information. Again, there are paper rulers, the sort of disposable rulers in there, where the practitioner can use to help you measure the length of this and the width of this. So measure the length of the laceration and in centimeters, and then the width of the laceration approximately. And then some qualities of the laceration. Is this a simple linear one? What location is this? Is there any contamination present? So in general, you can write down the location of the laceration. For most of these other things, length, width, whether it's simple linear, whether there's contamination present, you should be asking the practitioner about that. For the contact telephone numbers, you'll be asking the patient that directly, trying to get at least 2 if possible, and placing the patient sticker there with their information. And this has the information that this patient is to be randomized to non-resorbable. You will let the practitioner know that this patient has been randomized to non-resorbable suture. They will then tell you what suture they will be using, what suture type. Things like proline would be a common one, then 2-echelon is another one then too. So they will let you know what that is, and you will write that here. The suture size chosen, usually we're talking between, most commonly for these, it'll be either a 4-0, which is a 4-0, or 5-0, which is 5-0. You can write down here as the suture size. We want to know whether it is an NP, PA, EM resident, or EM attending that is doing the suturing. For the purpose, very important here, for the purpose of this study, we can't have medical students, PA residents, meaning there's sort of PA students, or an off-service rotator that's doing the suturing. So just make sure that the practitioner is aware of that. We normally a lot of times have students or junior practitioners practicing this, but for these particular patients in this study, we do need it to be one of these: NPPA, EM resident, or EM attendant. So the other one in which the patient can be enrolled would be the other is the absorbable suture. So if again, if they're randomized to absorbable suture, it's all the same information here that you're collecting. And then for the absorbable suture, we do need to make sure that they're using Vicryl Study. There is another type of absorbable suture we use called fast absorbing gut, but you're not using that in this study. It needs to be Vicryl Study. The practitioner will tell you what suture size they're using. Again, the same things apply here. It has to be just NPPA, EM resident, or EM attending. As a quick correction, this is what the sheet will look like, the initial sheet that shows the inclusion and exclusion criteria. This is all the same as what I showed you already. But this is what the rest of the sheet looks like. If the patient did not qualify, right, patient did not qualify on the note section on this second page, which I'll show you. And you'll put it down here. So if they inclusion and exclusion criteria, you'll note it here and checkbox it and write a note on it here and sign the data for yourself and then put it in the completed data form things. So if they do meet the inclusion and exclusion criteria, the provider will check the box sort of to attest that they met the inclusion and exclusion criteria, that the provider can answer any medical question the patient had about these sutures, and they'll check the box there. That provider will sign it then too. You'll also attest that the person who's conducting the procedure is not a medical student, PA resident, or off-service rotator, so you know right from the start that it's none of those people can do the disclosure. Research staff will then go ahead and check through these. So they should be checking all these boxes except on if the patient does meet inclusion exclusion criteria and yet it does not want to be part of the study, they go ahead and check it there and then make a note of their patient met criteria but does not want to be part of the study, and just make a note there and again sign it, date it, and you'll put it in the completed data form side. So okay, just quick. So we'll get back to the patient who we did they were randomized now to absorbable versus non-absorbable suture. They went ahead and had the procedure done. You will then actually, my advice would be to actually, before the procedure is over, you'll give them the proper instruction sheet. This is the instruction sheet that they'll receive if they are getting Vicryl repeat or those absorbable sutures as their suture. It gives them instructions on how to take care of these sutures, how to take care of the wound. And then we'll also give information which you can fill in here about this is, so they will be, it says on here basically that if the sutures haven't fallen out in 10 days to come back to get them removed then. So what you'll do is write the date here, 10 days from whatever the current date is, write that there. And advising them that in 30 days, they'll be getting a call back. So you'll write in that date, which is 30 days from the date that you're enrolling the patient here. And then advising them here about in 90 days, they will be getting another, getting set up to get the pictures taken. And again, you'll write that date in there and you'll give that to them directly, the patient. This is the discharge instruction sheet you would give them for the non-absorbable sutures, again, showing to come back in 10 to 14 days, or you can do the 14-day date here. Again, with writing in the 30-day date here and the 90-day date here. This gives them information about how to take care of their wounds and precautions to return with signs of infection. And again, this is the, at this point now, you have the patient been consented, either suture closure of their laceration. You've given all the discharge instructions. You will make sure and take, you will have given a signed, copied form of the consent to the patient. You will have taken all the other study materials that you did, getting all the patient information, the signed original consent form, and you'll be putting it back in the middle envelope and bringing it into one of the appropriate rooms in the ED and putting it into the completed data form slot there. And if any questions come up during this, make sure you're in contact with myself or with Jen Castaneda regarding this. Thank you.